Hello, my name is Rachel Allen, and I did my research presentation on antibiotic resistance and public health. And up top there, I have a quote from Alexander Fleming, who was actually the first person to discover antibiotics. By accident, he discovered penicillin. And he's quoted as saying, "The public will demand the drug, and then we'll begin an era of abuse." So he was pretty much able to foreshadow what would happen with society and the abuse of antibiotics. And so this problem exists in society and is now considered a global crisis, with new forms of resistant bacteria emerging all the time. This is particularly threatening because it can rapidly spread across different environments, and it's estimated more than 2.8 million antibiotic resistant infections occur in the United States each year, with 35,000 fatalities. These antibiotic infections are really scary because they require long hospital stays with often toxic treatment measures. And so it's very important to remember that antibiotics have been utilized to fight off infectious diseases since the 40s. However, if taken excessively or incorrectly, they can do a lot more harm than good. And ultimately, it's this overuse of antibiotics that has led to the resistance and even destruction of some normal flora in the gut. And so this disease can occur in various environments, but it's most common in clinical, agricultural, and veterinary. And the bacteria are able to become resistant through things such as selective pressure, mutation, and gene transfer. This is a big risk for the community as pharmaceutical companies don't see the financial benefits in funding research projects. And this really affects modern healthcare as medical procedures such as organ transplants and major surgeries would be very risky and prone to infection. Without prevention of infection, there will be longer stays in the hospital with more intensive care and costly hospital bills. And although antibiotic resistance can affect anyone, those with a weakened immune system are at a higher risk for infection. And so on the right here, I have two agar plates that are testing for antibiotic effectiveness. And I believe it's an E. coli lawn that spread over the plates. So on the bottom there, you see that there's a large zone of inhibition. So those antibiotics are working pretty well. But up top, there's less of a zone of inhibition, and that bacteria is becoming more resistant to the antibiotics. And so there are various ways on how to solve this problem. So one strategy is to focus on healthcare facilities, as this is where patients are getting healthcare-associated infections. It's estimated more than 63,000 patients from the United States die every year from hospital-acquired bacterial infections. It's really important for clinicians to be aware of the emerging resistant patterns and notify health departments of any unusual treatment failures. It's also important for them to inform patients on when antibiotics are necessary and educate everyone on the safety protocols. And another strategy that we can follow is to not share antibiotics or take them unnecessarily, and also to take antibiotics exactly how they are prescribed and follow pharmacist instructions thoroughly. It's really important to finish your antibiotic set and not stop it even if you feel better. And so, two plans that have started to solve this problem are the Global Antimicrobial Resistance Surveillance System, GLASS, which is an organization that aims to unite forces and create standardized approach in order to collect, analyze, and share data of antimicrobial resistance on a global scale. So their goal is to establish 4 new treatments by 2023. And they hope to improve existing antibiotics as well as accelerate research of new treatments. And also, the National Action Plan is a detailed 5-year plan that is geared towards finding new preventative strategies. And these include alternative therapies and vaccines. And so, where does this mean for antibiotic resistance in the future? So the literature says that we should educate those regarding antibiotic resistance because it hasn't really been effectively distributed to the public. And according to a study, when asked why individuals didn't follow through with instructions, 65% stated they either felt better or forgot to take their antibiotic in time. And this is proving that society isn't really aware of the dangers of antibiotics and how it's really important to follow the directions. So educating individuals on these dangers is essential, and there should be more global regulation on prescriptions. Another way we can prevent this is by staying vaccinated. This is very effective in preventing infections, and sometimes people can even take antibiotics unnecessarily when they have symptoms that could be caused by a virus like the flu. And so this will reduce the rate of secondary infections. And so, in my opinion, it's up to the pharmaceutical companies to take accountability for their responsibility in this multi-drug resistant epidemic. So, a lot of the pharmaceutical companies have stopped research on antibiotics because the sale of them are only a tiny fraction of what can be made from other medications for illnesses such as heart disease and high blood pressure. And the healthcare system also needs to be able to walk the fine line between protecting patients while simultaneously being cautious to prevent outbreaks. And they need to understand when it's solely able to prescribe antibiotics when necessary, and also when to inform patients on hygiene, how to keep wounds clean, and ways to prevent the spread of infections. And that's it. Thank you.